Hello everyone. In this video, we'll learn about this universal rights of childbearing women. Childbearing women are central to health of families, communities, and nations. Pregnancy and childbirth are natural, physiological processes, yet they can become life-threatening without respectful, ethical, and right-based care. Around the world, many women still experience discrimination, neglect, abuse, or denial of care during pregnancy and childbirth. So, the universal rights of childbearing women are a set of fundamental human rights that ensure women receive safe, dignified, respectful, and informed maternity care. These rights are grounded in human rights principle, international guidelines by WHO, UN, and ethical medical practice. Myself, Ruth Kezia, working as a lecturer in MMM College of Nursing. Objectives: we'll learn about the introduction, importance of childbearing period, growing evidence of disrespect and abuse, assertion of universal rights of childbearing women, and advantages to the mother, tackling disrespect and abuse, rights of the childbearing mother, role of healthcare providers, and conclusion. Introduction. Human rights are fundamental entitlements due to all people. It is recognized by societies and governments, and it is enshrined in international declarations and conventions. To date, no universal charter or instrument specifically delineates how human rights are implicated in the childbearing process or affirms their application to childbearing women as basic, inalienable human rights. So the rights of childbearing women are derived from human rights, women's rights, reproductive rights, right to health and life. So to understand this concept, you can think of the pregnancy as a journey on the road. Okay, the woman is the driver, healthcare providers are the guides, and health system is the road. Rights ensure that these universal rights will ensure that the driver controls the journey, the guide gives correct directions, and the road is safe and respectful. So without rights, the journey becomes unsafe, frightening, and harmful. So I hope you gain some idea on universal rights of childbearing women. The distinctive importance of the childbearing period. The concept of safe motherhood is usually restricted to physical safety. The notion of the safe motherhood must be expanded beyond the prevention of morbidity and mortality to encompass respect for women's basic human rights, including respect for women's autonomy, dignity, feelings, choices, preferences, including companionship during maternity care. So there is evidence for disrespect and abuse, and it is growing. In 2010, a landscape report by Bowser and Hill on exploring evidence for disrespect and abuse in facility-based childbirth summarized the available knowledge and evidence on this topic. Seven major categories overlap and occur along a continuum from subtle disrespect and humiliation to overt violence. Okay, so from small to large, there is a large amount of evidence of disrespect and abuse happening in the woman during childbearing period. That starts from subtle disrespect to humiliation to overt violence. They include physical abuse, non-consented clinical care, non-confidential care, non-dignified care, including verbal abuse, discrimination based on specific patient attributes, abandonment or denial of care, and detention in facilities. So these are the seven major categories of disrespect and abuse and corresponding rights for that. Tackling the disrespect and abuse and seven rights. First is physical abuse. Freedom from For the physical abuse, the corresponding right is freedom from harm and ill treatment. For non-consented care, The corresponding right is right to information, informed consent and refusal, and respect for choices and preferences, including companionship during maternity care. And for non-confidential care, the corresponding right is confidentiality and privacy. For non-dignified care, including verbal abuse, the corresponding right is dignity and respect. For discrimination based on specific attributes, the corresponding right is equality, freedom from discrimination, and equitable care. For abandonment or denial of care, the corresponding right is right to timely health care and to highest attainable level of health. For detention in facilities, the corresponding right is liberty, autonomy, self-determination, and freedom from coercion. Assertion of universal rights of childbearing. So how are we going to implement it? So we aim to address the issue of disrespect and abuse among women seeking maternity care and provide a platform for improvement by first is raising awareness. So what awareness we give is raising awareness of the childbearing woman's inclusion in the guarantees of human rights recognized in internationally adopted United Nations and other multinational declarations, conventions and covenants. Next is by highlighting the connection between human rights and language and key program issues relevant to maternity care, and by increasing the capacity of maternal health advocates to participate in human rights processes, and by aligning the childbearing woman's sense of entitlement to high quality maternity care with international human rights community standards, and by providing a basis for holding the maternal care system and communities accountable to these rights. So what are the advantages? It gives advantages of the universal rights of the childbearing woman. It improves the physical and mental health, freedom from abuse and neglect. It gives informed choice and consent and respect for privacy and dignity. Now we'll see the childbearing woman's rights in detail one by one. Okay. First is right to health care. Every woman has a right to health care before, during, and after pregnancy and during childbirth. Every woman has and infant has a right to receive care that is consistent with the current scientific evidence about benefits and risk practices. Harmful and ineffective or unnecessary practices should be avoided, and unproven interventions should be used only in the context of research to evaluate their effects. Every woman has a right to choose a midwife or a physician, okay, as her maternity care provider, and both the caregivers, that is the midwife and the physician, should be skilled in normal childbearing and skilled in handling the complications and ensure quality care for all the women. Every woman has a right to choose her birth setting from full range of safe options available in her community on the basis of complete objective information about benefit, risks and cost of these options. Every woman has a right to receive all or most of her maternity care from a single caregiver or a small group of caregiver. Every woman has a right to leave her maternity caregiver and select another if she becomes dissatisfied with the care. Every woman has a right to information about professional identity and qualifications of those involved with her care and to know when those involved are trainees. Okay. So if at all some trainees is giving care for her, she has the right to know whenever the trainees are attending. Every woman has a right to communicate with caregivers and receive all care in privacy, which may involve excluding the non-essential personnel. She also has a right to have all personal information treated according to the standards of confidentiality. So whatever the personal information the mother sharing with you, you're not supposed to communicate anyway. You have to maintain confidentiality. Every woman has a right to receive maternity care that identifies and addresses social and behavioral factors that affect her health and that of her baby. So she should be receiving information to help her take the best care of herself and her baby, and have access to social services and behavioral change programs that could contribute to their health. So if at all there is any behavioral change program you wanted to refer the woman, you should do so. Okay. And every woman has the right to full and clear information about benefits, risks, and cost of the procedures, drugs, tests, and treatments offered. Okay, so clear information should be given about everything. Okay, benefits and risks of the procedure, benefits and risks of the drugs, benefits and risks of the test, and the treatment offered. Everything should be clear and should be given to the mother. Every woman has a right to accept or refuse the procedure, drugs and tests and treatments. Okay, and to have her choices honored. So whatever we do for the mother, that is procedures, drugs, tests, and treatments, she has a right to accept, or she has a right to refuse also. Every woman has a right to be informed if her caregiver wish to enroll her or her infant in the research study. Okay. Every woman has a right to unrestricted access to all available records about her pregnancy, labor, birth, and postpartum course. So, if at all the woman wants any records about her pregnancy, labor, birth, and postpartum period, you have to give access for all the records. Every woman has a right to receive maternity care that is appropriate to her cultural and religious background, and to receive information in a language in which she can communicate. So that's very important. If the mother is Tamil and you cannot explain every technical terms in English. Okay. Every woman has a right to have family members and friends of her choice present during all aspects of her maternity. Even during the intranatal period, you have to allow at least one family member with the mother if she prefers. Every woman has a right to receive continuous social, emotional, and physical support during labor, birth, from a caregiver who has been trained in labor support. So you have to not only the physical care, you also have to give social and emotional care to the mother during pregnancy, labor, and birth. Every woman has a right to receive full advance information about risks and benefits of all reasonably available methods for relieving pain during labor and birth. So during labor, if the mother screams, you cannot just go off without addressing the pain because it is natural. If at all there is any interventions you have to do so without any hesitation. Even the non-pharmacological methods. She has the right to choose which methods will be used and to change her mind at any time. Every woman has a right to freedom of movement during labor, unencumbered by tubes, wires, or other apparatus. She also has a right to give birth in the position of her choice. So, right to freedom of movement, right for the position. So, all the rights the woman is having. Every woman has a right to virtually uninterrupted contact with her newborn. From the moment of birth, as long as she and her baby are healthy, we should not need care that requires separation. Okay, we should not separate the mother and the infant unless there is any requirement for separation to give care for the infant in the neonatal ICU or something, then only we can separate. Otherwise, you should not supposed to separate the mother and the infant. Every woman has a right to receive complete information about benefits of breastfeeding well in advance of labor, to refuse supplemental bottles and other action that interfere with breastfeeding, and to have access to skilled lactation support for as long as she chooses to breastfeed. So minimum 6 months you have to encourage, and more than that, as long as she feels like she can give breastfeeding. Every woman has a right to decide collaboratively with caregivers when she and her baby will leave the birthside for home based care on her choice. Okay, so even the discharge thing also the mother can decide. Role of healthcare providers. Healthcare providers should give respectful maternity care, ensure informed decision making, maintain confidentiality, offer evidence based practices, advocate for women's rights. Conclusion. Universal rights of childbearing women are essential for safe motherhood. Respecting these rights benefits both mother and child. Healthcare system must uphold and protect these rights for all the women. Universal rights of childbearing women are not optional, okay, privileges, but essential to human rights. Respecting these rights improves maternal and neonatal outcomes and strengthens the healthcare systems and promote gender equality. A right-based approach transforms childbirth from a feared medical event into positive and empowering experience. So, every woman has a right to give birth with dignity, respect, and safety, regardless of who she is or where she lives. I hope, thank you all. I hope you gain some knowledge on universal rights of childbearing women. Thank you.